Okay, this is a demonstration of showing how you apply a long stretch compression bandaging system called CetaPress. CetaPress is a high compression bandaging system that provides constant high levels of compression for the treatment of chronic venous insufficiency. In particular, it's very good for reducing edema of the lower limb. This compression bandaging system is designed to be put on in a spiral pattern, 50% stretch, 50% overlap from the base of the toes up to the knee. How we know that we're applying the right level of compression is if it's applied at 50% stretch. If we pull it out at full stretch and then relax it back to 50%, full stretch back to 50%. The idea is to turn these rectangles into squares. The green squares are providing a moderate level of compression and the brown squares are providing a higher level of compression. How we select our compression bandages is based primarily on the size of the limb, in particular circumference of the ankle and calf. Before you ever apply a compression bandage system, it's important that you establish the diagnosis based on history, clinical signs and symptoms, and lower limb vascular diagnostic investigations, such as an ankle brachial pressure index assessment. With those combination of assessments, that helps you to guide your diagnosis and make sure that the compression system that you're selecting is appropriate for that patient. So before we apply the compression, we want to make sure we measure the ankle, and when we're measuring the ankle, it's usually measured at 2 fingers above the medial malleolus and then the widest part of the calf. The reason for measuring the ankle or calf circumference is so that we can assess the effectiveness of that compression over time. What we're looking for is roughly around about a 1 to 2 centimetre reduction in ankle and calf circumference with subsequent applications of compression. Before we ever apply compression, there's a couple of things that you need. We need to make sure that we moisturise the lower limb first, have something to protect the skin from any irritation from the bandage, undercast padding to pad and protect bony prominences, in particular the tibial crest and the medial malleolus and the top of the foot. So we've got all of those things ready. First of all, we'll apply a pH neutral emollient, applying the moisturiser in the direction of hair growth from the top of the knee down towards the foot. That helps to reduce any bacteria entering into the hair follicles, to reduce the risk of something called folliculitis. So just a gentle moisturiser applied to keep the skin integrity and good condition. Okay, then before we apply compression, I often use something as a tubular retention bandage, and the idea of that is it can help to hold dressings in place, but also helps to avoid any sensitivity from the undercast padding on the skin. I usually select enough that we can do an undercast padding, a tubular retention bandage over the skin, and then a second layer over the top of the bandage once we've finished applying compression. It's always advisable, if you have them available, to use an applicator device to avoid causing any trauma to the skin on application of the bandage. Okay, so just leave your excess rolled up, and then we can use that at the conclusion of the bandage. Undercast padding is designed to be applied from the toes up to the knee, paying particular attention to the bony prominences over the top of the foot, the ankles, the tibial crest and the tibial tuberosity. So what we do when we start to apply undercast padding is just gently pull the bandage and wrap it around. I'm doing a heel lock, or figure of 8 around the ankle, as that just provides extra level of padding to that area. And then just wrapping it around. Now, if you have areas that are particularly bony prominences that you're concerned about, or highly contoured limbs, you can use additional undercast padding to protect those areas. For example, we can use for bony prominences over the ankles, just a couple of layers of undercast padding, and then create a little a triangle which we can place over those areas. For really prominent shin bones, we can do similarly, applying a couple of layers of the undercast padding over the tibial crest. And the idea is to keep everything smooth underneath the compression, as any wrinkles and ridges that you have, that can be transferred onto the skin. In this instance, because we've got a normal shaped limb, we would not require those additional layers of padding. Now, as we start the bandage, we're wanting to make sure that we apply it at the base of the toes, so all 5 toes are visible. We apply just a low level of pressure as we're applying the bandage, and that's purely to keep the bandage in place. So no tension would mean that it would slip, so just a small amount of pressure is what's required. So a gentle loop around the foot, making sure that the foot is at 90 degrees, so that when we're applying the bandage at pressure, we're not causing any trauma over the anterior tibial region. So looping it around the foot. Take it around to the back of the ankle. Again, this is just a light tension, there's no full tension being applied. And then once we get to the back of the ankle here, we start to apply the bandage at 50% stretch. If you're first learning how to use the bandage, good idea to pull it out to full extension and then relax back to 50%. Again, the goal is to turn those rectangles into squares. When we're pulling the bandage, we're always pulling it from the rear. And 50% stretch and 50% overlaps means that 50% of this bandage is always placed back on the limb. Once we get to the top of the knee, so we're about 2 fingers below the kneecap, we want to stop compression at this point and just at no tension wrap the bandage around the top of the knee. And that just allows for discrepancies in different styles of application and compression. And then you can cut this bandage and then secure with tape. Now this bandage can be washed multiple times. A good way to keep track of the number of times that you've washed the bandage is to use a permanent marker and just cross off the squares as you remove the bandage, and that helps you to keep track of the number of times you've washed that bandage. It's important that you follow the manufacturer's recommendations for care of the bandage to get the best life out of that. Now once we've finished applying the bandage, we just use our tubular bandaging and then reapply that up limb. And the idea of that is that it helps to keep the bandage in place, avoids slippage, and means that the patient can get normal footwear on much more easily. So 5 toes are visible, goes up to the top of the knee, and a nice smooth application. You can see that the tension is even. Does that feel comfortable?
It does, thank you.
You're welcome. And then of course, once you finish applying your compression, it's very important that you provide the patient with education on some of the precautions that they may need to consider with compression therapy. And obviously your changes based on clinical signs and symptoms, such as the amount of exudate that we might be producing, or levels of physical activity for that patient. But essentially that's the technique for applying a long stretch high compression bandaging system, in particular the Cetapress. Thank you.